Commissioner Clemente,
Here.
Commissioner Kenizic, Chair Scott,
Present.
you have a quorum present.
Thank you. We have a full board. All right, thank you so much. Okay, next item, please.
B, Chairwoman's remarks.
I have none.
C, approval of the June 7th, 2023 meeting minutes.
I'll make that motion, Madam Chair. Move to approve the previous minutes.
Commissioner Khalil, thank you.
I'll second it.
Commissioner Kara, thank you.
Clementi.
Clementi, I'm sorry.
Yeah.
All in favor?
Aye.
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 Any opposed? Hearing none. Roll call vote. Thank you.
D, unfinished business. There is none listed.
Okay, thank you. Next item, please.
Item 1, under new business, a presentation by Jason Machieski, Chief Executive Officer of the Senior Alliance Area Agency on Aging, 1C.
Thank you so much. Good morning again. Mr. Jason Majewski, who I thought I didn't know, but
Turns out you did.
it's been around a while, so thank you. Nice to have you.
Thank you, Madam Chair. I appreciate the opportunity to appear this morning before the committee and give you an update on what we're doing at the Senior Alliance. I do have a PowerPoint presentation. I did provide hard copies this morning, and I'll be using that as a bit of a guide. There's a lot more information in there than I'm gonna cover verbally, and really would appreciate any questions that you have at the end as well. I want to start with who we are. We are an area agency on aging. We are designated by the state of Michigan to play that role. And Chairwoman, I know from your history in government, you were around in local government back in the day when Mayor Young and Curtis Hertel from the House and Ed McNamara, who was mayor of Livonia at the time, and Governor Milliken came up with a plan to form the area agencies on aging in the state of Michigan. And we're involved with creating the Detroit Area Agency on Aging that covers the city of Detroit, Harper Woods, Hamtramck, Highland Park, and the Grosse Pointes, and then the Senior Alliance, which has the designation as Area Agency on Aging 1C, covering the 34 municipalities of Western Wayne and the Downriver area. So we hold that designation, and there are 16 different area agencies on aging in the state of Michigan. We happen to be the third largest in terms of population and people that we serve, with about 1 million residents, and about 240,000 of those are age 60 and over, which is the definition of an older adult given to us by the Older Americans Act. We were incorporated back in 1980. We are a nonprofit 501c3 organization as well. Our mission is to really assist people to thrive as they live, age, and grow in the community. We have really a vision of helping older adults and caregivers have a healthy future and the opportunity to engage and connect in their community. And we do that in a variety of ways. And on the third slide, you'll see the next slide, you'll see the map of our service area. Again, Western Wayne and Downriver. And on the next slide, you'll see our board. We are governed by a board of directors. And as an area agency on aging that was kind of formed by the communities that we serve, we have a connection back to the Conference of Western Wayne and the Downriver Community Conference, as they both appoint members of our board of directors, as well as our board then appoints at-large members. So our board is 15 people that govern. They meet about once a month, and they have a variety of committees to make sure that we are compliant with the rules and regulations from the Michigan Department of Health and Human Services, as well as the Administration on Community Living at the federal level. The next slide will show you our revenue sources, and this is a kind of a key slide to understand what we do. We are not a service provider directly for the most part. Half of our revenue comes from something called the My Choice Waiver Program, which is a Medicaid in-home services program where people can get a waiver from the Medicaid program to receive services in their home rather than in a nursing facility. And there are income requirements for that, and there are medical requirements for that. So that is kind of half of our revenue, this Medicaid in-home services program. We've been doing that for 25 years and look forward to continuing that program of long-term services and supports. The other half of what we do is a mix between Older Americans Act funded programs, which is the traditional aging work, your Meals on Wheels, transportation, health and wellness programs, information and assistance, Medicare and Medicaid assistance program to help people enroll in those two programs. The traditional work that people think of as older adult programs and services. And then we're involved in something called My Health Link, which is a demonstration project, another long-term services and supports demonstrations project. Again, in-home services for dual eligible, both Medicare and Medicaid people here in the state of Michigan. And that program is transitioning to a dual special needs plan. We are contracted now currently with two different insurance companies who are demonstrating My Health Link here in Wayne County. And we will continue to do that as they transition to this new version, this new model, the special needs plan model in a couple of years. So that you kind of understand that we are more of a contract administrator. We do assessment work, we do case management work, but we're not the company that's in there doing the work in home. We have a vendor network of over 100 different companies in the private sector that we contract and oversee to do that work in people's homes. That's an important distinction. So on the next slide, I'll get into the Older Americans Act, and I'll kind of flip through these really quickly for the sake of time. But again, the Older Americans Act is kind of the governing document signed back in 1965 by President Johnson that eventually established area agencies on aging and many of the programs and services that we offer. On the next slide, you'll see that information and assistance is kind of the foundation of that. It's a call center where people can reach us and ask us anything about aging. And we kind of serve as a hub to refer people to resources that might be available in the community. One example would be if somebody calls us and that we identify they're a veteran, well, we will connect them with Wayne County Veteran Services. Or if they are interested in Meals on Wheels, we will connect them with the Wayne County Meals on Wheels program. And a variety of things. Sometimes they call and they just want to know where their senior center is, and we'll direct them there. So we're kind of a hub for providing that kind of information and making those connections and identifying resources for people. The next slide, you'll see something that we've developed through our information and assistance operation. We now have an online resource directory. So pre-COVID, people would call us during our business hours and talk to one of the four people that work in this department. But what we've done over the last few years is transitioned and brought online a public-facing resource directory via our website at thesenioralliance.org, where people can go in and actually search through the resources that we have at any point in time on Saturday or 4 in the morning or whatever they want to do, and find that information there as well, much more accessible. And that was something that we brought online within the past year and found it to be a great resource. The next slide talks a little bit about our transportation program. We are one of the few area agencies on aging that operate a transportation program here in Michigan. We have 5, we're on our second round of vehicles now. We've been doing this for over 10 years. 5 Ford Transit Connects, and we provide the ride of last resort. So we try again to connect people with other transportation resources, whether it might be public transit or community transit in their own municipality. But we have 5 vehicles where we can take people to doctor's appointments, the Social Security office, MDHHS, Secretary of State, those kind of official kinds of business interactions they might have with government, or a clinical appointment. And that's what our focus is. We do have a number of people that are also on dialysis, and we provide them rides as well. One key thing to our program is that we go over municipal boundaries. Many communities in our service area will only drive within their city. We can take somebody, for instance, that might live in Rockwood to a doctor's appointment they might have in Canton. And so that's a bit unusual. So we do that on a very limited basis with the 5 vehicles that we have. A great resource in case you ever encounter constituents who might need that service. On the next slide, we offer health and wellness classes. And I'll highlight one called Matter of Balance, which is a fall prevention program. We operate this in partnership with a couple of different places, including the National Kidney Foundation of Michigan. And this is the most popular evidence-based program in the country. Helps people learn about avoiding falls and how to fall if you're going to, and how to go through that. We know from our work that falls are a leading cause of hospitalizations and encounters with the clinical community. So we want to do what we can to reduce that. So we invest a lot into the Matter of Balance program. The next slide will get into caregiver support. Another focus of ours. Many of the people that we contact through information and assistance or out in the community are the caregivers for older adults. And so we put some effort into providing respite, primarily for people that are participating in some of our other programs like care management, and give them respite opportunities so the caregivers can get a break. We have adult day services with Woodhaven Retirement Community and an organization called EAI to provide kind of daytime activities for a small group of people, but those are longstanding services that we have supported out in the community. Again, entities that we are contracting with to actually do the service, not ourselves. And again, support groups and hotlines for caregivers. We're looking forward to doing more caregiver work with our American Rescue Plan Act dollars that we received from the state and federal government, including bringing online trainings. We found that caregivers don't really have time to arrange respite for the person they're caring for to come to an in-person training. So we're trying to enable more of the remote on-demand kind of training for caregivers, and we're going to be bringing that online as well. And we've got other programs that we're doing online. There's a program called Get Set Up, which is the Michigan Department of Health and Human Services operates. We're constantly driving people to utilize that tool as well in their own homes. So that's some of the work that we're doing with caregivers. The next slide highlights the Medicaid Medicare Assistance Program. For me, this is another foundational program of what we do. Many times in the fall, if you're watching TV, you'll see these ads for the Medicare open enrollment period and sign up for this plan, sign up for that plan. Well, we get funding from the state and federal government to operate something that we call MAP, MMAP. And this is a group of volunteers for the most part. We have over 40 people that are trained, very heavily trained in Medicare and Medicaid rules and enrollment regulations. And they volunteer throughout our community. I have a handout. One of the handouts I gave you is this 8.5 by 11 sheet. Gives you an overview of the MAP program and some of the locations that we visit on a regular basis every month. But the MAP program is great because if you are enrolling in Medicare or Medicaid and you don't understand the litany of choices that is presented to you when you have to do this, or the Part D prescription plan, you can sit down free of charge with a Medicare and Medicaid Assistance Program volunteer or one of our staff members and have all these things explained to you, what the implications might be for your particular income and asset level, so that you as an individual can make an informed choice about what Medicare plan you want, what Part D plan you want for the next year. It is an incredible program. We save people in aggregate term, almost $1 million a year by adjusting their choices for Medicare to what they really need. And again, we do this independently. We do not advocate for one plan over another. We simply present information to people. And it's a fantastic resource. The next slide is Friendly Reassurance Program. We operate this. It's kind of a friendly caller. It's peer-to-peer, older adult to older adult for the most part, where we put a call in. Could be 5 days a week, could be 1 day a week, could be somewhere in between, just to check in on older adults that might be isolated. It's one of the interventions that we have for isolated older adults. We have a couple hundred people currently on this program. Another great resource in case you are encountering constituents that might be frequent callers to your office and they just need somebody to talk to. Well, this is a great program for them. And it's really peer-to-peer, and the folks that make the calls get to know the participants in the program. They build a relationship and they talk about their grandkids and all the things that they're doing. We found it to be really successful. The next slide is the Long-Term Care Ombudsman. This is another state-funded program that we house in partnership with the state. And this is the person that is working with families and residents of nursing facilities in our service area. It is a daunting job for our long-term care ombudsman to cover all of the facilities across our service area. We're fortunate that our ARPA funding allows us to have a part-time person to assist with that right now. But it is definitely very valuable, works with the family councils at the nursing facilities, and really tries to make sure that the rights of residents are being adhered to. The next slide is our nutrition programs. And this is, I'm going to highlight the fact that we, as the Area Agency on Aging, are the contract administrator for the nutrition programs, which here in Wayne County, we have not only home delivered meals, which you might know as Meals on Wheels, which is kind of the brand name, but also congregate meals where people go to different sites, typically around lunchtime for a meal. We also have a halal meal program. We're up to about 90 participants in the halal program operating in Dearborn Heights with a restaurant called Country Chicken out of Dearborn, which is fantastic. And they operate the halal program. And then we have a liquid nutrition program. Though that's the basis of the nutrition programs that we have. And we contract with Wayne County Department of Senior Services that does the day-to-day operations. Director Jackson is with us today from the department. And we work with them as they do the day-to-day work. We administer it from a contractual level to make sure we're adhering to all the state standards. And we're really proud of that partnership that's existed for 40 plus years with the county, and I look forward to continuing it into the future. We also do something called holiday meals on Easter, Thanksgiving, and Christmas. The regular program run by the county on a day-to-day basis doesn't operate on those days. So the Senior Alliance has adopted those 3 holidays where we recruit volunteers and our staff, and we go out and handle those days. And that's part of our work as a nonprofit, is we do that work. We also have Senior Project Fresh, which is a farmers market program with the Department of Health and Human Services, where we get a couple of 100 coupons and we distribute those to older adults so they can get fresh fruits and vegetables. We're right in the middle of that season right now. And then we have an emergency grocery shopping program. We, on occasion, get calls from people who say, I'll give you an example. They get discharged from the hospital. They live alone. They've been in the hospital for 3 weeks and now they're home and they have no food, and they will contact us. And then we have an emergency shopping program where we will go out and on a one-time basis, get them some food to get through. And maybe they will get on to the home delivered meals program or some other resource for long-term, but for an immediate emergency situation, we're able to do that as well. Now, so nutrition programs are really key in terms of what we do as an Area Agency on Aging. Next slide is in-home services and care. And I touched on My Choice Waiver, the My Choice Waiver program at the beginning, talking about our revenue. But we also operate something under the Older Americans Act called care management and case coordination and support. Some places they call it community living services. It's a different kind of version of in-home services, a lighter version, kind of housekeeping, homemaking. We serve over 1,000 people on that program. And we have a wait list of around the same number of people. And we advocate every year in Lansing to get additional appropriations to end that wait list. This year we got an additional, I think, roughly $600,000. We were seeking $9 million to eliminate the wait list, but we continue to advocate that as well. And we advocate on nutrition programs and other things as well. The My Choice Medicaid Waiver Program, again, a key program for us in line with our mission to keep people living in their homes. And we work very closely with the Michigan Department of Health and Human Services on that program, a really key part of what we do. And we'd be happy at any point in time to talk with you one-on-one. You can get very in depth on My Choice, but really, really important part of what we do. And the next slide, we are charged to be an advocate. And we do that work in Lansing, in Washington, and kind of here today. I'm advocating on behalf of our agency and the people that we serve. We have an extensive policy platform that really focuses on things going on in Lansing and in Washington. On a variety of things, whether it's elder abuse or appropriations. We are very active in that arena. I'm proud to say that we are getting an award this Sunday from our National Association U.S. Aging, recognizing our podcast Inside the Senior Alliance, which we are finishing up our 3rd year of that podcast right now. And it's been being recognized as a national model for podcasts related to aging advocacy. We're quite proud of that and look forward to receiving that award on Sunday. But again, a big part of what we do is advocating not only on policy and budgets, but for individuals and services as well. The next slide is again kind of an array of some of the things that people can benefit from through the My Choice Waiver Program, a variety of the services that they can receive through that program. And again, it is income dependent, asset dependent, and medical dependent, and they have to have a nursing home level of care need to qualify for that program. But with our available slots that we can utilize right now for that program. And finally, on the next slide, volunteer opportunities, whether it's delivering meals, which we know that more volunteers are needed for the home delivered meals program, whether it's joining us for a holiday meal delivery, becoming a MAP volunteer, volunteering with the Long-Term Care Ombudsman program, being a member of our advisory council. We have open spots for older adults, caregivers, people in the community that are interested to be on our advisory council to review some of our plans and our documents and make recommendations. And then if they want to get involved in advocacy, we have volunteer slots that are available for that as well on the Michigan Senior Advocates Council. They meet in Lansing once a month and they go knock on legislators' doors and talk about those issues in our platform. So we have lots of opportunities for people to volunteer. If you know of people in the community that have time and they have that energy and want to do that, we'd be happy to plug them in to volunteer opportunities. And the last slide is simply our contact information. We are here for you as your resource for older adults and caregivers. We'd be happy. We work with many of the county commissioners in our service area on assisting with constituent cases and connecting people to resources. And with that, Madam Chair, I would be happy to answer any questions you might have. And I forgot to recognize Amanda Sears, who's our Director of Advocacy Planning Projects. Amanda's back here in the green sweater joining me today. And we'd be happy to answer any questions you might have.
Oh, thank you so much for that presentation. It was just awesome. And congratulations on the award that you'll be receiving this Sunday. You guys have done great work. You took me back a few years at the beginning of this. I chaired the committee that separated. Yeah, under the old 27 Board of Commissioners.
We appreciate your long-standing support.
Yeah. Yes, indeed. Okay, I know we have plenty of questions. We don't have that, so, okay. Commissioner Clemente.
Thank you, Madam Chair. Thank you for coming, Jason. I really appreciate you coming here and sharing all of this with us. I have volunteered with your program and I kind of sit in a space where I am a full-time working person along with caregiving for multiple adults in my family. And I have a question about how people qualify, and if they don't qualify, what services you have for people that don't qualify. And then I'll have a follow-up after that.
So let's take, for example, if somebody calls us, they don't really call us and say, I want to enroll in My Choice, or I want to enroll in, they don't know the names of the programs, they know their situation. And so that's what our information assistance team does. So they will evaluate somebody that might be seeking in-home services, and we'll go through the process of identifying options counseling, basically. So we'll go through that process with them of seeing if the My Choice Waiver, explaining what My Choice Waiver is, explaining what PACE is, explaining what home help is, and explaining what care management is. And so they have an opportunity to maybe understand what their choices are and then make an informed decision. And then we can go down the road of determining eligibility. So we may start with My Choice Waiver if they identify an interest in that. If they identify an interest in PACE, then we will refer them to PACE of Southeast Michigan, which is in our area, and they'll go through that process. But if they identify an interest in My Choice, we can get them over to the My Choice people, and they can do those asset tests and see if they qualify medically. Now, if they don't, then we can step to care management, which doesn't have those kind of tests and see. But then again, we have 1,000-person wait list, and it's probably going to take a year to get through it. So if they don't have that, then we can supply them with a kind of private pay option and information about what options they might have in the community to hire somebody to come in and do that work. Maybe if they don't qualify from a financial standpoint, right? And then we also, we do a lot of questioning. Are you a veteran? Are you the spouse of a veteran? Do you have mobility issues? We try and identify isolation. So if they may not qualify for an in-home services program straight off, we try and identify other programs that we can link them with or offer, so they can choose or choose not to participate, up to them. But we kind of run through that process with people to make them aware of the resources that are available. A lot of times we refer out to other organizations. So there are food pantries that we work with for an immediate need situation. But there are times where there just isn't an applicable resource. And we provide them information about our other programs and services for when that time comes where it may become applicable to them. So I'm not going to sit here and say that every person that calls us is going to get signed up for a program and service, because it doesn't happen that way. But we do our best to connect people. And many times it ends up being with a different organization and different services, whether it's, typically some other nonprofit or other human services organization. But we try not to let people just drop off. We're there to try and make that connection.
Thank you. So I serve parts of Detroit and outside of Detroit. There's a different area on aging for Detroit.
That's the Detroit Area Agency on Aging.
Okay. And then my other question was, your health and wellness classes, is that just for people that participate in your program, or can caregivers come with people, or? does that
So
work?
there are some evidence-based programs that are for caregivers that we hope to bring online. But typically, I don't know about caregivers participating in the programs, which I don't think will qualify because they don't meet the age requirement. But typically 60 and over. But there are a variety of evidence-based programs, and even ones that we don't fund, that we can provide referrals to.
All right,
Thank you very much.
Thank you, Jason. Anyone else? Commissioner Colleen?
Thank you, Madam Chair. Yeah, I'm in DAAA.
Mhm.
PACE services. What's the capacity for that? Are there more people wanting those services than we have the capacity to deliver them? How is that working?
I think so we don't operate PACE. We're not
I know.
involved. We're not owners of it. It varies from PACE program to PACE program. So I will say that, we're surrounded by PACE programs. There's Huron Valley PACE, there's PACE Southeast Michigan. They are expanding. They have slots available. I think the program in Grand Rapids in this year's budget from the state got additional slots. In Bay City has openings, St. Clair County. So they really vary.
But here in our area,
In our area, there are openings in PACE programs.
so you don't have to turn anybody down, because that's the future, keeping seniors at home.
So there's different models, right? So PACE is a model where, you're living at home, but then you're going to a PACE facility
Right.
for your services, and they have transportation to do that, versus My Choice, which is solely in home. So they're just different models. And if people express an interest in PACE, we certainly get them over to the PACE folks. We have a good relationship with them. They sit on our advisory council. Roger Myers, who's the head of Presbyterian Villages in Michigan, is involved in PACE Southeast Michigan as a member of our board of directors. So we feel like we have a really good relationship with the PACE
But
program.
you don't, from your end, you don't see any capacity issues.
From what I know of the PACE programs in our area, there is available capacity.
Okay. Thank you. And the other thing is mental health services. How do you, because you connect people,
Mhm.
but what mental health services are available? What can they get through Senior Alliance?
So we operate a pilot project, which we call Hearken. And that is a very small project that is trying to link people who are isolated, that's the population we're focusing on, to behavioral health services. And we have been working with a company called Hagera, is a link there, but really trying to bring that behavioral health component to people on the care management program, like in that Older Americans Act in-home services program. So that's kind of a pilot that we are operating. We have traditionally not provided behavioral health services directly. And within MDHHS, that's a whole separate thing.
Right.
But we're happy to have a Michigan Health Endowment Fund grant to do that pilot. But we will typically refer people to other available resources to provide behavioral health.
What's the need out there for behavioral health?
Extensive.
services? Yeah,
It's extensive.
because now we're in the age of integrated health. So everybody, government, companies, are all learning how to do the integrated thing and offer those services. Do you feel that there's enough out there right now that you
No.
can get people? There's just, yeah,
You think about our Meals on Wheels program, right?
right.
To me, the value of that program
Is the
is
knock on
way
the
more
door.
than just the meal. It's the volunteer coming to the door,
Yeah.
having that check with that person every day. My in-laws are on the Meals on Wheels program in Ypsilanti. And we value that because we know every day somebody is appearing at their slider on their deck, saying hi to them, checking on them, when we can't be there every day, right? So to me, that's the value of the program. And that's why we have been so steadfast on having a home delivered meals program operated by or delivered by volunteers. They're laying eyes on somebody every day. We have many, many stories about you knocking at the door, the person not answering. We go through our protocol and it turns out that they're unconscious on the floor in their kitchen.
Yeah.
And we were the ones who ended up calling 911 to get them help. It's to me, that's the real value of the home delivered meals program.
Yeah, a lot of friendships develop between
Absolutely.
people that deliver the meals. So you're talking with Lansing in terms of behavioral health services. What's the future there? Where can advocacy be the most effective to improve behavioral health services for seniors?
I think, for us, I think it's going to be mixed into what's going on. When you talk about the dual eligible population, people on Medicare and Medicaid, that's probably the easiest thing to look at. And in terms of moving to that new model out of My Health Link into this new model and potentially integrating services into that in the future, I think that would be an opportunity. The need is just so far beyond what we can address with our current resources. Yeah. And when you say integrated care, that means different things to different people. People look at that implementation
Especially people
differently.
chasing down funding.
Right. And I'm very aware we have an administrator in the department here in the room as well. So,
Yeah, right.
but it means different things to different people. And I think for us, we're very much a community-based organization. We value that person-to-person touch and that community interaction. And we believe that we're effective in it. And, we're always looking for opportunities to bring more behavioral health services in. And this initial pilot project, I think we've gotten some really good results and realizations from it. And maybe in the future, we can build that out with a partnership, whether that's a partnership with a health insurance company or a hospital or what it might be. But, we're in the infancy of that kind of work at the AAAs.
Thank you. Thank you, Madam Chair.
Thank you, Commissioner Khalil. Is there a waiting list for your Meals on Wheels program?
There is not. We are very proud to not have a waiting list.
That is fantastic.
Yes. In partnership with the county, I will say that the county has done incredible work in the past to make sure that the funding is available to not have a wait list on that program.
Thank you. Commissioner Dodd.
Thank you, Madam Chair. Jason, could you very briefly speak on the services that you provide to the LGBTQ community? I think it's very important, especially right now with what's going on in our political culture these days.
Certainly. Thank you for the question. I appreciate that. 7 or 8 years ago, we were one of the pioneering area agencies on aging to have our information and assistance team. Again, the folks that work those phones and interact with people at the front door of our agency, not only went through LGBTQA plus training, but were involved in developing the protocols and operational standards for doing that work. And we're very proud to have done that and to keep that available. Our staff are routinely trained on resources that are available. We routinely go out and seek resources that can be available. And one interesting aspect of this, which I had not realized until we got involved in the work, was abuse in facilities for people who identified as LGBTQ. And that is an issue that our long-term care ombudsman is attuned to. And we've seen many cases where people in essence go, to use the phrase, back in the closet when they have to go into a nursing facility or some kind of congregate living situation because of the potential abuse that has been experienced there. And so we're very attuned to that. We have resources and again, training to how to communicate and work with people. So we're quite proud of that, and to be a model for that for other area agencies on aging. So I appreciate the question.
Great, thank you. Do you foresee any, well, I mean, I don't know, I guess maybe we don't need to talk about this, but I guess we all kind of foresee more problems with the recent Supreme Court ruling, and you mentioned problems in facilities. So I'm glad to hear that your team, continues the training and that we're aware of problems of potential abuse, and that's really good to hear. So I think we can just leave it at that. So
Good to hear that. I hadn't thought about that.
Right.
Wow.
thank you, Madam Chair.
Yeah, thank you. Anyone else? Well, thank you so much, Jason. I mean, that was just a great presentation that you did. Appreciate you, and we know that you are well equipped you've been around and know a lot to help people do things. So
Again, thank you for the opportunity to be here today. Really appreciate it.
yes, we're so glad to have you. Thank you so much. Okay. Do we have anyone from Veterans Services that would like to say anything today? All right. Yeah, come on up. Put your mic on, please. Oh, it doesn't. Well, come and have a seat, please. Mhm.
I don't have a lot. Like I'll say, good morning, commissioners. I'm the office manager for the Veteran Services Department. Randy Walker, my director, he apologized for not being here. Everything is going good in the Veteran Service Department. We are looking to go over $1 million going into fiscal year 24. And that's an emergency assistance for our veterans. We have applied for the CVS grant going to fiscal 24, and it looks like we're going to be granted over $700,000. And that's from the MVAA, and that's for emergency assistance.
What will that grant do?
That will cover for emergency assistance for our veterans that comes into our office, like the burials, anything that falls up under the CVS.
All right.
Yeah. Other than that, we don't have anything else to report.
Thank you so much for
Thank you.
just being here.
Yeah.
I know that you were not on the agenda, but
Yeah.
I thought I saw you.
Yeah. Randy was like, go ahead. I'm like, okay.
Yeah, he
So-
did call and say that he had some other issues today.
Yes.
All right.
Okay.
Does anyone have any questions of her? All right.
Okay.
Thank you so
Thank
much
you.
for being here. Anyone else from the department would like to have anything to say? No? Anyone in the audience? Okay. Well, hearing none, next item, please.
F, such other matters as may be properly submitted before the committee.
Okay, there's none that I know of. Okay. Next
G,
item.
public comments.
Anyone from the public online or on the phone? Anyone wishing to make a statement? Anyone? You don't see anyone.
There are no emails and no hands raised on
Okay.
Zoom.
All right. Thank you so much. Next item.
Adjournment.
Moved and supported. All in favor? Aye. Okay.